for housekeeping purposes, we do want to let you know that after the session today, the GoToWebinar program will email out approximately 1 hour following the session to all the attendees. You will get a certificate of attendance. We are unable to do CEUs, but you will get a certificate of attendance regarding the session today. If you have any concerns or questions regarding that, please feel free to get in contact with us and we will make sure that you get a certificate. Please feel free throughout the session to submit questions or comments either through your question or chat option in your control panel that should be on the right hand side of your screen. You should have a drop down option for questions or chat. And I will be taking notes throughout the session on any questions or chats that come through so that we can get those answers back out to you following the session as those come in. And also, the session that we have going on today, as all of our webinars are, will be archived on our website under the support page. You can find any webinar that we do at www.biaia.org. And with that, I'd like to present Lisa. She's one of our facilitators at BIA. She's been with Brain Injury Alliance of Iowa for 16 months as a neuro resource facilitator. Prior to that, she's got great experience in the field. She's been in human services for about 21 years, working with a provider for 15 years prior to joining us as a supervisor with supported community living services for adults with brain injury. She also has experience working with supported employment in the 24-hour group home arena and with individuals with a variety of disabilities. Lisa also spent 2 years in long-term care as an activities director in elder care. So she brings a great deal of knowledge to our team. And today, one of her passions that she likes to research and share information on with our team is concussion and how to deal with concussions. And so today she's going to present on helping a family member manage concussion. And so with that, I'd like to go ahead and turn the reins over to Lisa and have her present to you today. Lisa, go ahead. Thank you.
All righty. Well, good morning, everyone. I hope everyone's staying warm out there today. Again, my name is Lisa Jennison, and I'm a Neuro Resource Facilitator here at the Brain Injury Alliance. Today, we're going to talk about helping a family member manage concussion. In order to better understand concussion, let's first discuss how our brains are set up and how they actually work. The effects of a brain injury depend partly on the injury's location. Understanding the brain structure and function is very helpful. The brain has two halves, which are called the cerebral hemispheres, and each hemisphere has 4 parts or lobes. The brain's parts work together to control all your movements, feelings, thoughts, and behaviors. If you look at the diagram below, you can see in the gold color in the back, that's your occipital lobes. They receive and process the visual information. The purple area is called the parietal lobes. That's located in front of the occipital lobes. The parietal lobes process information from the sense of touch, from your body's position and space, and from body awareness. Then take a look at the yellow portion. That is called the temporal lobes. They're located on the side of your brain, and the temporal lobes specialize in memory and hearing. The dominant temporal lobe is usually on your left side. Is important in the speech and language. And then lastly, the light blue portion, that big part in the front, that's your frontal lobes. And they're located inside the front of the skull. And the frontal lobes are the largest lobes. They control voluntary movements that you think about and that you do, like getting out of a chair. They're also responsible for organizing information, solving problems, attention span, regulating emotion and behaviors, self-awareness, memory, language, and communication. One thing about a concussion is that you normally cannot see a concussion. A concussion is a mild traumatic brain injury. On 99% of the general CAT scans and MRIs, they will come back normal in presentation, indicating that there are no structural changes to the brain tissue or the neural structures. A concussion cannot be seen on a CT scan or MRI because it is a microscopic injury. It occurs at a cellular level. A CT or MRI may be completed still in order to rule out other issues such as like an intracranial bleeding, contusions, or lesions. The CDC defines concussion as a type of traumatic brain injury, or a TBI, caused by a bump, blow, or jolt to the head that can change the way your brain normally works. Concussions can also occur from a fall or a blow to the body that causes the head and the brain to move quickly back and forth. So what is actually happening in a concussion? A concussion occurs when chemicals within your brain cells are unbalanced and disrupted. There is an inefficiency of the cells in the brain to properly deliver the much needed nutrients to the brain. A brain needs glucose to do about any type of physical and mental activity, and it is hindered without having it. After a concussion, because the cells are so dysregulated, sometimes even like sitting up in a chair may be too demanding for the person, and they may only be able to sleep at that point. Some 4 areas that are usually affected by a concussion kind of are in 4 different separate areas. In the physical area, headaches, nausea, vomiting, dizziness, balance issues, visual disturbances, fatigue, sensitivity to light and noise, and numbness in the extremities. Like headache is basically the #1 complaint and symptom of a concussion, and it can be like dull and achy, and just like usually with activity it gets worse. Dizziness, that's when it starts spinning when you stand up. It's different than lightheadedness. You may have difficulty with heights, moving crowds, stores, spiral staircases, busy patterns, and just heights in general cause dizziness. And just balance, people may just have balance problems like in a dark room. It's just hard to maintain their balance even like on the stairs, and people maybe even bang into the walls. Visually, people might have blurry, foggy vision. Light sensitivity is pretty common. And fluorescent lights tend to be the most bothersome. This also can be one of the last symptoms to resolve with a concussion. And also just difficulty reading. Your depth perception may be off. Seeing double. Sometimes people have problems with that. Cognitively, mental fogginess, just processing things slower, difficulty in remembering information, problems with concentration and sustaining attention, reduced initiation and difficulty completing even familiar or previously learned tasks. So just like people may just have a really foggy, slowed down feeling, and they sometimes have a hard time defining it, but some people say it feels like your brain is a computer with a virus, or like your head is underwater, or your head is maybe in the clouds. Usually after this resolves, people are like, whoa, I'm like, wow, I'm better. They feel so much different. Concentration and memory problems, people just have difficulty focusing and maybe only be able to read or be like on the computer for 10 to 20 minutes before their symptoms increase. They can't remember what they hear or what they read and may have difficulty learning new information. They may repeat themselves or lose their train of thought, forget what they say in a conversation. Then emotionally, people might have irritability, sadness and depression, nervousness. They might be anxious or more emotional, may have lability problems and personality changes. Just irritability is usually present early on with a concussion. And also if people had psychiatric symptoms before the concussion, this is often becomes worse with having a concussion. Same with depression. But depression also can be just brought on because you're not able to do the activities that you were previously able to do. Anxiety is also really common just because people don't have a definition of when they're going to recover or if they're going to recover. Sleep, that's another area. People may be drowsy, sleeping less or more than normal. They may have difficulty falling asleep or staying asleep. Altered sleep also delays the recovery just because you're not getting enough sleep. You don't want to sleep all the time, but the first couple days they say that's really what you need to concentrate on in the first couple days. But then after that, kind of maintaining the same sleep-wake cycle as you had before is good. Some different things that also complicate the recovery from concussion. Having a previous concussion, that definitely complicates the situation. A history of migraine headaches. A history of a learning disability like ADD or ADHD. History of depression or an anxiety disorder. Having a pre-existing mood or sleep disorder. Nutritional habits affect your recovery. Smoking cigarettes and marijuana, recreational drug use in general. Your stress levels, not having enough support, just general medical issues before the concussion, and also PTSD. With the concussion, you need to keep an eye on the person, and there are certain symptoms that you kind of want to make sure you look out for that can happen that could indicate a bigger problem. So if you see any of these issues, I would contact your doctor or call 911 immediately to get them checked out. Just really any of your original symptoms begin to worsen as time goes on. If you observe any significant behavioral changes, your headaches, they become more frequent and more severe. Having neck pain, the person's like difficult to awaken out of sleep. Repeated vomiting, slurred speech, increased irritability, aggression, or combativeness. All of a sudden they're not recognizing familiar faces or places, or having increased confusion or disorientation in general. Any kind of weakness or numbness of the arms or legs, seizures obviously, checking their eyes when pupil is larger than the other, and just being less responsive than usual. After a concussion, one of the most important things to the individual is getting rest initially. This helps the brain recover. As a caregiver, you want to make sure the person is okay, though. It used to be standard practice that the concussed person should not sleep and they should be kept awake. Nowadays, we know that's not the correct protocol. So this is just one way to do it. You following these steps within the first few days to conduct a symptom check without disturbing them. This is just kind of a nighttime checklist. That's just an option. First, initially, you want to make the person aware that you'll be checking on them throughout the night, so you're not scaring them or startling them. You have a flashlight on hand, but obviously don't point it right in their face. Just using it so you don't trip too, mostly. Observe their breathing pattern while they're sleeping. I mean, is it normal? Is it abnormally slow or abnormally fast? Is it labored? Is the person sweating? How is their face color? Is it flushed or gray or normal? Is the person twitching at all? I mean, that could indicate possible seizure activity. You can gently lift up their wrist and take their pulse. How is their pulse? Is there missing any beats? Is it erratic? You can also, if the person sleeps well, you can lift up their eyelids one at a time to kind of observe their size of their pupils, because again, you want them the same size. Just knowing that, because of the dark room, they will be enlarged because of that. Now the next question is just how do you recover from a concussion? Again, the key to recovery is sleep and resting physically and mentally. Getting plenty of sleep and naps and going to bed early, especially the first 1 to 2 days. You want to definitely avoid any activities that cause another injury. things like sporting activities, climbing, swinging, biking, running, roughhousing, gym class, that kind of thing. Avoiding lengthy mental activities, that involved prolonged concentration. I mean, you want to rest your mind. Texting, reading, watching TV, computer, schoolwork, even video games, avoiding bright light, loud music, noises, parties, and sometimes driving and work have to be modified too. Rest means, you don't want to create more symptoms. So if you're doing these things and it's creating more symptoms, then you need to be resting more. Also, just visitors, limit visits initially from 30 to 40 minutes, so you're not overdoing it. Again, just some general do's and don'ts with a concussion. The do's, obviously do take your pain meds as prescribed by your doctor. You can use an ice pack for your head or neck for pain. Sleep when you feel tired, but also enjoy some, fresh air, some short walks in the shade. Engage in mentally stimulating activities gradually again, and we'll talk a little bit more about that, but backing off if you get symptomatic. So if your symptoms, like you get more headaches, make sure you're backing off that activity. And sometimes it's even helpful to journal some of this to kind of find out maybe what your triggers may be, because it's kind of different from, each individual. Reducing the light and noise in your environment. Sometimes you can use earplugs, for noise, and sunglasses for the light. Talk about your feelings. And even listening to books on tape or relaxing music, or simple tasks for short periods of time is helpful. Some don'ts. Don't remain in bed all day for days on end. I mean, that's not good either. Light activity and routine is good. Don't drive when you're symptomatic. Exercise, I would hold off on that, and especially lifting weights. Drinking alcohol and smoking cigarettes, drugs, a lot of caffeine, I would avoid all that stuff. And again, video games sometimes can be a trigger for some people. Then just moving on to some statistical information with concussion and mild traumatic brain injury. This kind of shows you a graph of just the different areas of people and the causes of mild traumatic brain injury. From 2006 to 2010, falls were the leading cause of traumatic brain injury, accounting for about 40% of all traumatic brain injuries in the United States that resulted in an emergency room visit, hospitalization, or death. Falls disproportionately affect the youngest and oldest age groups. So more than half, 55% of those TBIs among children were 0 to 14 were caused by falls, and more than 2/3, 81% of the TBIs in adults were age 65 and older caused by falls. Unintentional blunt trauma or being hit by an object was the second leading cause of the traumatic brain injuries, accounting for about 15% of TBIs in the U.S. from 2006 to 2010. Close to a quarter, or 24% of all TBIs in children are less than 15 years of age were related to the blunt trauma. Among all age group, motor vehicle crashes were the third overall leading cause of TBI at 14%. And then about 10% of all TBIs are due to assault. And then it goes on to the others, 19%. Just some other general statistics about concussion. Estimates of between 1.6 and 3.8 million concussions in the U.S. occur in sports. 50% of the concussions are estimated to go unreported. 80 to 90% of concussions resolve in 1 to 2 weeks. And 20% of high school football players will sustain a concussion each season. Most people with concussion do recover quickly and fully, which is good news. But for some people, symptoms can last for days, weeks, or even longer. In general, recovery may be slower among older adults, young children, and teens, especially those who've had a concussion in the past before that. There are also somebody that's had one concussion is at risk for having another one. And then obviously it does take longer the second time or multiple times to recover from it. After a concussion, some people lose consciousness or actually like knocked out for a period of time. However, most concussions, that's not the case, and they don't result in a loss of consciousness. So just because, I mean, if you had a concussion, that doesn't mean that you were knocked out. Not being able to remember events or amnesia prior to or following the injury for a period of time is another sign of concussion. Yet some people just simply feel dazed or, confused at the time. Some other recovery issues, things that people could deal with that you may have heard of are second impact syndrome. This is a rare but catastrophic occurrence. It may lead to severe debilitation or even death. It involves a second injury to the brain before the initial injury is actually fully healed. It can be prevented by the immediate removal from activities following a blow to the head and strict adherence to your recovery plan. Really in sports, they always say report any hard hits because it doesn't have to be helmet to helmet. In football, I mean, it can be just a hit to the body. And it may take 1 to 3 days for symptoms to show up with a concussion. So, I mean, that one saying, when in doubt, sit them out. I mean, it's really true. Then post-concussion syndrome. This is a complex disorder in which various symptoms such as headache, dizziness, and different things last for weeks and sometimes months after the injury has happened. And, it possibly can be prevented or helped by just, again, strict adherence to your recovery plan. So getting back into the swing of things, into your routine. I mean, parents and caregivers are encouraged to develop this on-off type of schedule for their child or for their family member while they're at home on cognitive and physical rest. An on-off schedule can be created in however you want to do it, but this one's like in 30-minute increments, and it reflects periods of gentle physical activity mixed and or cognitive stimulation mixed with periods of complete rest. So this is just kind of an example of, the person getting up, they do a little bit of something, then they rest, and kind of go throughout the day like that to kind of work themselves back into their schedule without overdoing it. When a person has a concussion, there may be many players on your team to help with recovery. These are just some examples of people that may be involved on the team of helping somebody get over a concussion, but not maybe for everybody. But obviously the person themselves is involved. If they have parents or caregivers in the picture, they help with monitoring and reinforcing the consistent use of safety guidelines throughout the process. They advocate for necessary services for that person. Your primary care provider, they would monitor your general overall health status, provide input into the recommendations for your symptom relief. They often also need to provide some clearance for a student's return to school and or play. The neurologist, if they're involved, they monitor the neurological status of the person. They order and review follow-up imaging tests to evaluate recovery if that's something they need. The physiatrist, if you're lucky enough to have one, they monitor the rehabilitation aspect of recovery. Some are actually post-concussion specialists. They may use the Sports Concussion Assessment Tool or the SCAT-3. And they offer input into when it's safe and appropriate to return to sporting activities. The neuropsychologist also is an important person, or even a school psychologist. They evaluate your cognitive executive functions, and they make recommendations for academic modifications. They identify potential barriers to academic success. They evaluate your psycho-emotional changes and offer recommendations for treatment, whether it be pharmacological or psychotherapy. They assist in the creation of a behavior management plan also, possibly. The ophthalmologist, they could, if the person's having visual issues, they can be pulled in. They can assist in identifying and treating short-term or long-term changes in the visual acuity or visual perception. They may offer support into the person's sensitivity to light. The physical therapist may be involved. They do assessment and remediations of changes in balance, mobility, strength, and endurance. They can offer input and expertise in the development of a plan for transitional return to physical activities and sports. Functional vestibular assessments and rehab, and they can initiate and monitor the use of a headache journal, just journaling, your activity type, your duration, your environment, how long it lasts, and how intense it is. They can also help to grade the progression and return to physical activities. The OT, or the occupational therapist, they can assess and changes in your fine motor control, like of your hands, strength and functional use of your arms. They can also help with the ADLs, or the activities of daily living. And they can offer input and expertise regarding vision and handwriting, keyboarding, relative to schoolwork or work. The school nurse, if the person's in the school system, they obviously would monitor the student's general health and recovery while they're at school. They can administer concussion signs and symptoms checklist, administer any prescribed medication throughout the school day. They'd also can provide the student with a quiet space to rest if they need that. And they can act like a liaison between the parents and the medical professionals. Sometimes, if the issue goes on longer, a special education director may be pulled in to help facilitate any assessments that the student may require upon return to school, the development of a 504 plan or an IEP, if that's needed, and then they would also monitor the plan. At the college level, this role is typically performed by the Student Disabilities Services Department, and they may have supports, things like tutoring, classroom modifications, testing modifications, maybe a note taker, counseling sessions, extra time to test, peer support, the opportunity to learn specific strategies to address new difficulties with memory and organization. And then just your academic staff, if the person's returning to school, your teachers or your paraprofessionals, they would also monitor that academic performance in the classroom and the homework, implement any recommendations made by the special ed team or the disability services, with any kind of curriculum changes or classroom modifications or accommodations. They also document the student's performance both objectively and subjectively. The guidance counselor would be the person to provide the emotional support to the student during their ongoing recovery and adjustments. They would assist the student in dealing with changes in peer status and social relationships, and then identifies community supports. Then the athletic staff, if they're involved, they would, if it happened on the field, or wherever in that specific thing, that they would recognize the early symptoms of the concussion if it happened there. They might perform an initial assessment, like on the playing field, determine the possibility of concussion and initiate the first response plan. They monitor the student athlete during the transitional phase back into physical activity. And they need to adhere to the recommendations made by the healthcare professionals regarding the level of activity in post-concussion recovery. The pharmacist is very helpful too. They can offer recommendations for pharmaceutical control or relief of symptoms in post-concussion. And audiologists sometimes may get pulled in to evaluate short-term or long-term changes in your hearing, or vestibular system if they have dizziness, or the management of tinnitus if they have that ringing in the ears. They also can create a customized earplug that can reduce the background noise, but also allow the person that's wearing it to be able to hear conversations at the same time. And then the last person kind of on the list is a speech and language pathologist. They often devise compensatory strategies for executive functions and memory, such as notebooks and organizers. Training in language development and assessment and treatment of language disorders is a specialty in their field. So The next thing we're going to do is just watch a little video on the topic of returning to play. You have to bear with me for a second. And this is from the CDC. I hope it works. Let's see. There we go.
Hi, I am Dr. David Sugarman, an emergency department physician with the Centers for Disease Control and Prevention. I'm here to speak with you about helping young athletes safely return to play after concussion as part of the CDC Expert Video Commentary Series on Medscape. For many of us, the first chance to assess a young athlete with a suspected concussion will not be on the sidelines, but in our office or emergency department. Your examination will likely include a physical examination covering cognition, neurology, balance, and most importantly, any signs of deteriorating neurological function. When managing an athlete with concussion, your management plan should cover both returning to school and to play, and should monitor both physical and cognitive activities, consider concussion history, and be individualized to the athlete. Outside of the emergency department, in most cases, it will be possible to monitor the athlete where you work, especially if the number and severity of symptoms are steadily decreasing and gone within 7 to 14 days. If you work in an emergency department, an athlete should be referred for follow-up care from a healthcare professional who can help him or her gradually return to school and to play when fully recovered. An athlete should not leave an emergency department and return to practice or play the same day, nor should a future return to practice or play date be given at the time of an emergency department visit. There are 5 gradual steps to help safely return an athlete to play, adapted from the International Concussion Consensus Guidelines, return to play progression. As the baseline step of the return to play progression, the athlete needs to have completed physical and cognitive rest and should not be experiencing concussion symptoms for a minimum of 24 hours. Keep in mind, the younger the athlete, the more conservative the treatment. The first step is light aerobic exercise. The goal is to only increase the athlete's heart rate. The time should be for 5 to 10 minutes. And the activities include exercise bike, walking, or light jogging. Absolutely no weightlifting, jumping, or hard running. Step 2 is moderate exercise. The goal of this step is to limit body and head movement. The time should be less than your typical routine. The activities include moderate jogging, brief running, moderate intensity stationary biking, and moderate intensity weightlifting. Step 3 is non-contact exercise. The goal of this exercise is to increase intensity without contact. The time can be closer to the typical routine. The activities include running, high-intensity stationary biking, and the player's regular weightlifting routine and non-contact sport-specific drills. This stage may add some cognitive component to practice in addition to the aerobic and movement components introduced in steps 1 and 2. Step 4 is resuming practice. The goal is to eventually reintegrate into full contact practice. Step 5 is returning to play. The goal of this step is to return to competition. It is important to monitor symptoms and cognitive function carefully during each increase of exertion. Athletes should only progress to the next level of exertion if they are not experiencing symptoms at the current level. If symptoms return at any step, stop these activities, as this may be a sign the athlete is pushing too hard. Only after additional rest, when the athlete is once again not experiencing symptoms for a minimum of 24 hours, should you start again at the previous step during which symptoms were experienced. The return to play progression process is best conducted through a team approach and by a health professional who knows the athlete's physical abilities and endurance. By gauging the athlete's performance on each individual step, you will be able to determine how far to progress the athlete on a given day. In some cases, you may be able to work through the one step in a single day, while in other cases, it may take several days to work through an individual step. It may take several weeks to months to work through the entire 5-step progression. Before the start of the season, learn about your state, league, or sports governing body's laws or policies on concussion. Some policies may require you to take a training program or provide written clearance as part of the return to play process for young athletes. Remember, while most athletes will recover quickly and fully following a concussion, some will have symptoms for weeks or longer. You should consider referral to a concussion specialist if the symptoms worsen at any time, symptoms have not gone away after 10 to 14 days, or the patient has a history of multiple concussions or risk factors for prolonged recovery. This may include a history of migraines, depression, mood disorders, or anxiety, as well as developmental disorders such as learning disabilities and ADHD. More details on diagnosing and managing concussion among young athletes, including return to school planning, are included in CDC's online course for healthcare professionals, Heads Up to Clinicians. To access the course, go to www.cdc.gov/concussion. Thanks for watching.
All right. Well, just to kind of recap what he just went over, here's a graduated return to play step by step. This is one other way to do it. It's, I think, a little different than what he just said, but basically with the same steps. It's just in there's a different amount of steps, I think. Stage 1, again, is just no activity at all. Symptom limited physical and cognitive rest, and the objective at that point is just to recover. Then you move into the light aerobic exercise, your walking, swimming, or stationary bike, no weight training at that point, and just to increase your heart rate. From there, stage 3 is just sports-specific exercise, skating drills, running drills, no head impact, and just to add some movement. Moving from that to stage 4, non-contact drills, progress to more complex training drills, exercise, coordination, and cognitive load. Stage 5 would just, again, be the full contact practice, following the medical clearance by the professional, participating in normal training activities, and restoring confidence in assessing your functional skills. And then stage 6 would be returning to play. Normal gameplay, no restrictions. And just a reminder, to move through these steps, the athlete needs to be 100% symptom-free for 24 hours before they move to the next step. And longer periods of time for younger athletes. If they're a younger child, then that needs to be a longer time frame. If symptoms do reemerge, then drop back to the previous step at that point. Now that we've talked about, returning to play, here's another important milestone is, recovering from a concussion is returning to learn. Prior to a student returning to school, it should be determined that symptoms are tolerable, they're short-lived, and or amenable to rest and intervention. Returning to school and engaging in some level of learning should be feasible if the symptoms are manageable at that point. If they're intermittent, and school professionals are able to support the student through appropriate academic adjustments. The benefits of having a student passively attend school at this point, even just listening and observing, it far outweighs the secondary issues that may arise from keeping a student out of school for too long. The 3 stages basically are, the first stage is staying home. You're on bed rest at that point. That's when the child's symptoms are so severe that they cannot concentrate for even 10 minutes. They should be kept home on bed rest. Don't be texting, driving, reading, video games, all that stuff again. Limited homework and TV. And it's unusual, if this is their first concussion, that this state should last beyond a few days. And obviously consult a physician if it does last more than 2 days. Moving into the next area, staying still at home but light activity. If your child's symptoms are improving, but they still are only be able to concentrate about 20 minutes, you should still keep them home, but not on total bed rest. They can start light mental activity, sitting up watching TV, light reading. Again, as long as your symptoms don't worsen. So you just want to back off if you're becoming symptomatic, and build in a little more rest. Then transitioning back to school, when your child's be able to concentrate or being able to tolerate about 30 to 45 minutes of light mental activity, then you can consider returning them back to school. The parents should communicate with the school, the school nurse, teacher, again, the mental health counselor, just about bringing the student into school for the first time after the concussion, so everybody knows what's going on. Parents and the school should decide together the level of academic adjustments needed, depending on the severity of what types of symptoms they're having. the type of the symptoms present, the times of the day when they feel better or feel worse. When returning to school, the child must, at that point, sit out of physical activities until they do the return to play. So like the gym class, the highly physical active classes, and even physically active recess. And even if the person is sensitive to sound, maybe keeping them out of the music class or the band class until they kind of recover from that would probably be a good idea. Okay, the next story, this video is just a short video about, her name is Tracy. She's a teenager that was a basketball player, and she had a concussion previously and didn't report the second concussion, and she kind of talks about her story of what happened with her. So give me just a minute and I will get that on. I think. Oh my gosh, okay. Just bear with me for a second here. I had it queued up and then I lost it. In these stories, you can get this information on the CDC website. It's an excellent resource. It has a lot of stories and a lot of good information that you can look at and hear. And that's kind of where I'm accessing this, I hope. There we go.
It was January 10th, 2005. I was 17 years old, and my high school basketball team was playing a varsity game, and it was around the second quarter, and I was going up for a rebound, and as I came down, the back of my head collided with the top of another girl's head. The next day, after the day I got hit, I went to school, and I was really sick. I knew I had a concussion because I suffered through a concussion my 7th grade year. I had all the symptoms, dizzy, nauseous. I couldn't focus in school. I continued to play a second game after that, and I passed out after the second game in the locker room. Basically, I was bedridden in my house for about 6 months straight. I slept on the couch because of the light. We had to put dark sheets over the windows. My mom and my sister had to help me walk around. I lost my balance. I couldn't really get that back for quite a while. I didn't know it could get this bad. All athletes have a strong will, and since we're young, we know that we have to suck it up, suck things up, whether you sprain your ankle or you hurt your finger. You just go in the game and you shake it off, and you don't complain, you don't cry. But this is a brain and head we're talking about, and you can't suck it up. So unfortunately, instead of missing a game, I missed the season. I missed sports for the rest of my life, and I missed out on a great life that I could have had. Athletes need to know, if you think you have a concussion, don't hide it. Report it. It's better to miss one game than the entire season. You can find information on concussions at www.cdc.gov/concussion in youth sports.
Okay. Alrighty. To learn more about concussions, again, you can check out these resources. I've kind of listed a few different things that you can look through and pull up different information about concussion. And one of the laws, we're going to talk about that, the Senate file, on April 7th, 2011, Iowa enacted Senate File 367. This act is concerning the protection of students from concussions and other brain injuries. In this act, the Iowa High School Athletic Association and the Iowa Girls High School Athletic Union shall work together to distribute guidelines of the CDC and other pertinent information to inform coaches, students, and parents, guardians of the students, the risks, signs, symptoms, and behaviors of concussions and the risks of not sitting out and responsibility of reporting symptoms. Also, annually, each school district and non-public school shall provide a signed concussion or brain injury information sheet for students in grades 7 to 12. A coach needs to immediately remove from play any student with observable concussion or TBI signs or symptoms. A student cannot participate until they have been evaluated and provide written clearance by a licensed healthcare provider trained in the evaluation and management of concussions or TBI. In that previous slide, there is a link to that also to look at the full thing. And just to kind of talk a little bit about us, at the Brain Injury Alliance of Iowa, we're here to provide information and support to all Iowans. We work to prevent brain injury, all types of brain injury. I mean, I think people don't always think of a concussion as a brain injury, but it is a mild traumatic brain injury. And improving the quality of life for individuals and families living with a brain injury. And we just help to educate others about this. With our mission this year, we're excited because we're working on a goal through our Health and Resources Services Administration grant. We'll be working on developing and completing a needs assessment for coaches, school administrators, parents, and athletes regarding TBI and concussion risk signs and symptoms. And with that information, we're hoping to put together a comprehensive packet to give out and be able to educate people on concussion. So the Brain Injury Alliance, here we provide a free service for anybody that needs information. So, you know, always feel free to contact us by phone or email because we're always here to help. And then that kind of just leads me to my contact information. Don't hesitate to contact me by phone or email if you have questions or just want some more information on concussion or TBI or anything surrounding brain injury itself. So I just want to thank everybody for being with us today. And again, make sure you get any questions to us that you may have. And I appreciate your participation.
All right. Well, thank you very much, Lisa. That was a great topic, and we know that concussion is something that a lot of people are talking about, so we certainly appreciate that information. And for those of you that are still on, please feel free to submit questions through the question box, the chat box, or you can certainly feel free to email directly to Lisa. She'd be glad to answer any questions that you have. We will, like I said, the certificates of attendance will be going out from the GoToWebinar system in about an hour after we close down. And the webinar itself will be archived on our website. So please watch for that and share that if you know of anybody that might be interested in viewing this information. And with that, please have a great day and thank you for attending.